Hello, my name is Amir Aran, MD. I'm the Chief of Hand Surgery at Kaplan Medical Center in Israel. I would like to talk to you today about carpal tunnel syndrome. First, I should state a disclaimer. This does not substitute medical advice given by a medical professional, which you should seek if you find symptoms, as we will talk about in a couple of minutes. Professional advice is important for your health, and this video does not replace it. Now, let's talk about carpal tunnel syndrome. If you experience having numbness or tingling in your hands, if you tend to find that once you could easily button up your shirt with one hand, but now this does not happen that easily, if you have some numbing pain going up your arm, if you have things falling from your hands suddenly, then you might have carpal tunnel syndrome. Carpal tunnel syndrome, as the name implies, talks about having pressure in your carpal tunnel. Where is our carpal tunnel? The carpal tunnel itself is here in the carpus. You will see that there is pressure which actually happens because there are 9 tendons going through the tunnel. These tendons are 1 from the thumb and 2 for each of these fingers. On top of all these tendons going through your carpal tunnel, there's the median nerve. The median nerve supplies 1, 2, 3.5 fingers. And this median nerve is also important for performing adduction with your thumb. So, when you have numbness and tingling which emanates from the carpal tunnel, it will most probably come up and be in these 3.5 fingers. It might just happen in your thumb or in the other fingers as well. In order to make the diagnosis, we will perform several tests as doctors. One of these tests that you can use at home is called the felon test. If you just use your hands, put them together like this, bend them at the wrist, and you keep them bent like this for about 1 minute long, you will, if you have carpal tunnel syndrome, and this is I would say, quite a reliable test, you will feel some numbness and tingling in your fingers, usually your 3rd finger at the end of it, over a period of about 1 minute. So, when you have carpal tunnel syndrome, it happens because there is pressure within the carpal tunnel. As you can see here, the transverse ligament is right here in the carpus, and all the tendons pass through the tunnel itself, as well as the median nerve, which I here signify by this red rod. What we do in these cases is we assess the condition of the nerve because this pressure has been applied over the nerve for a long period of time. This will be done by an electromyography. Electromyography will tell us what the latency is in the response of the nerve. If we have late response of the nerve to this electrical stimuli, which is done during the electromyography, the nerve is actually injured by the pressure. And hence, we can make a diagnosis of carpal tunnel syndrome. It is made clinically, and the electromyography adds to our clinical diagnosis. We will start, in this case, with non-surgical interventions. This might be physiotherapy mobilizing your nerve. This might be a night splint, which you might get, or other modalities. The surgical intervention, which is quite common, this is one of the most common surgeries performed in the Western world, actually entails cutting through the transverse carpal ligament, which is what covers the tunnel that we have here, the carpal tunnel. So what we do is we take a scalpel, or in other situations, another modality, and we will be cutting through the ligament itself, thus allowing more space for the nerve and the tendons, and eventually this transverse ligament will heal like this instead of the pressure that was there before. The surgery is quite easy to endure, and about 12 to 14 days later, you should have mild pain over the surgical site, and you should enjoy having your hand back and getting your function again. So this is Carpal Tunnel Syndrome. Thank you very much, and all the health to you. Thank you.
אחלה. אני צריך רק את ההתחלה, עוד פעם, כי אין פה איזה ממש סאונד.
בסדר גמור.
של מה זה, ושהתחלת if you עם הכפתור, וזהו, אז אתה יכול
להמשיך. אוקיי. בסדר, אני זוכר את כל המהלך, בסדר. אוקיי, רגע, אז... טוב, זה חזרה. השאלה אם צריך לעשות את ה... כן, בואו נעשה את ה... נחזק את הרצועה מחדש. כי היינו אז מזה, או שאני לא זוכר?
לא צריך, אתה יודע מה? לא צריך, כי אני אעשה קצת... בכל מקרה, מבחינת עריכה אני צריך קצת להתקרב לך, לא צריך אפילו.
מה?
כשאתה מראה את זה בהתחלה, אתה לא מראה את זה.
אני לא זוכר. שנייה, אני אסגור את זה. אני אשים אחד, רק נסגור את זה.